Good morning, everyone. I certainly hope you can hear me. Welcome to a beautiful day and our fourth annual symposium. My name is Steve Belko. I'm the Executive Director of Missouri Humanities. And every spring, Missouri Humanities hosts a regional symposium in Springfield in partnership with the Humanities and Ethics Center at Drury University, one of my alma maters. And a recurring theme is always humanities and the future. And previous symposiums have addressed a range of challenging subjects surrounding this larger approach, such as the future course of democracy in a pluralistic society, environmental humanities, bioethics, and medical technology. And it's my pleasure to welcome all of you to the fourth annual Humanities and the Future Symposium, The Future of Work. And today we have convened students, scholars, and community leaders in this virtual format to explore how work shapes our shared human experience. So through a series of interdisciplinary panels and presentations all day long, participants and attendees will examine workforce development, practices and trends that impact how, where, and why we work as we do. You can view the full schedule at our website, mohumanities.org/future of work. Now, Missouri Humanities is a nonprofit organization, and our mission is to enrich lives and strengthen communities by connecting Missourians to the people, the places, and ideas that shape our society. And the best way to sustain our mission is to join us, become a member of Missouri Humanities. There are various levels of support and benefits, from free books, discounted tickets to special programs, and access to members-only events. And to become a member, visit our website, mohumanities.org, and click memberships under the donate tab. So join the movement at Missouri Humanities as we work to build a more thoughtful, informed, and civil society. Missouri Humanities is live streaming today's program via Facebook. The format will be 20 minutes of presentation in each session, followed by 20 minutes of Q&A at the end of the presentation. Now, if you're joining us by Zoom, the Q&A feature is at the top of the screen. Feel free to submit your questions through the Q&A feature at any time. And I promise I will try to answer as many of those as possible at the end of the session. Tomorrow, you will receive a link to the post-event survey in your email box. So please fill this out. This is important for our program evaluation. The survey will take less than 5 minutes to complete, and your feedback is definitely helps us direct and inform our future events. So I also want to thank my Deputy Director, Ashley Beard-Fosno, who creates and supervises and does everything to make this symposium possible. She's also based out of the Springfield office. So if it wasn't for Ashley, we would not be here today. So I definitely want to give a special thanks to her. So let's move on. It is now my great pleasure to introduce the first speaker of the symposium, President and CEO of United We, Wendy Doyle. Wendy advances all women's economic and civic leadership using evidence-based research and policy solutions to make meaningful change. Wendy's nonprofit career began as a national major gifts officer with the National Kidney Foundation, and she worked as a nonprofit consultant who focused on board development and strategic planning. She later served as the executive vice president of Catholic Charities of Northeast Kansas. She earned her BA from one of my favorite places, Rockhurst University in Kansas City. And she serves on the Women's Health Council, the Missouri Foundation for Health's Missouri Opportunity Incubator, a junior league of Kansas City, Missouri's C3KC advisor, University of Missouri, Kansas City, Starr Education Committee, Park University Civic Advisory Council, and the LaunchCode Kansas City Advisory Board. Welcome, Wendy. I'm turning it all over to you until you get back with me for the Q&A session. Thank you.
Thank you, Steve. I'm so honored to be here today with you, and a special thanks to Ashley as well for all of her support and work on today's conference. So I thought I would just start with just a little bit additional background about United We. And United We stands for United Women's Empowerment. And our mission and our work is to advance all women's economic and civic leadership. And we do this in a couple of ways. We invest in research, we build out a nonpartisan policy agenda, And then we get to work to reduce economic barriers for women and their families. We are celebrating 30 years this year, and we know that this work can lead to envisioning a world where women are empowered to strengthen our country's economy and democracy. And on the next slide, you will see that at United We, research is a very key principle for the organization. And we have invested in more than 19 research studies to date. We really believe that research is the base of all of our work that we do. And we are going to talk today about the importance of, sorry, we're having just a couple of technical difficulties here. We're going to talk today about the importance of our research study that we've just completed called The Status of Women in Missouri. And our update to the research report was released in November 2020. We are committed to updating the research periodically so that we can really bring forward to Missouri progress that we've made, but further identify opportunities. And to get started, I am going to focus on, we would be remiss if we weren't discussing the impact of COVID-19. And the report that came out from the Department of Labor in December 2020 was extremely telling. And to the viewers that are watching today, you may have noted that 100% of the job losses that were reported were by women. And this really was a culmination of several factors, one being that childcare is such a critical factor that was really putting women in a difficult position to having to choose between work and family, and especially with children, moving to remote school or virtual learning, this really put families in a very tough position, having to choose. We also know that the impact really hit hard for the sectors that women were representing: the service sector, the restaurant industries, women's small businesses really impacted significantly. So we would be remiss if we weren't talking about the impact of COVID-19. I think a really telling statistic to share is that currently, right now, the participation of women in the labor force working or looking for a job is equivalent to the numbers that women were participating in 1988. So that tells us that we have fallen backwards 33 years for women's participation. Why is this important? For us at United We really are looking at what, and this is based on a statistic from the McKinsey Global Institute, really what can really accelerate Missouri's economy. And if women are fully participating in the workforce, we can grow our economy by as much as 10 to 15%. But that means full participation. So COVID-19 has really put, highlighted how important this is, but really some additional obstacles that we need to overcome. So I want to go back to, the Status of Women in Missouri research study. And this is really a partnership that we developed. I know that this is, some friends of the organizations from the University of Missouri's Institute of Public Policy. And we've teamed with them together on this research study. We released an original one 6 years ago. We then came back 2 years later and did an update. And then we've done a subsequent update that was released in November of 2020. So again, our commitment to keeping the facts and data updated to really share with Missourians where we're making progress and where there are opportunities. First and foremost, why this is really important. Factual data is the first step in telling the accurate story, to sharing that with Missourians, to inform them, to educate them, but also to educate our policymakers on what's really happening in the state. And as the World Bank recently stated, that this is one of the biggest barriers to closing the gender equality gap, is really the lack of data and evidence, which is really why, as an organization, this is a foundational principle for us. Secondly, the accessibility of the data. We want everyone to have the opportunity to educate themselves, to review the data, and understand what the critical issues that may be impacting them personally or as a state. And finally, this data will really help, as I mentioned, to identify innovative solutions, policy changes that we can make at the local, county, and state level. And of course, our ultimate goal for United We is we really want to get results and impact the economy for Missouri women and their families. So kind of shifting to really the study and some of the components of the study. First, it has qualitative and quantitative data included in the Status of Women in Missouri study. So one of the things that we really did to inform our friends at the University of Missouri is we convened 2 listening sessions of Black women back in July of 2020. And it really focused on the issues that were holding back Black women economically, but also what was holding them back from their civic participation, and highlighting the impact of COVID-19. So all of that qualitative information is shared in the research study. Secondly, the data analysis. So partnering with the University of Missouri's great thought leaders around the table, we really narrowed the playing field and zeroed in on a few key indicators that we really thought could really tell the story of what was happening in Missouri. And finally, as I mentioned, our commitment to updating the research study. So a couple of themes and specific barriers of women's full economic participation really come out loud and clear through our key indicators, which are focused around employment and income, healthcare, social and economic issues, education and childcare, and then leadership and public engagement. And our categories of focus really highlighted young women, working women, older women, women of color, and women veterans and military spouses. So the first key indicator that I just wanted to highlight is the employment and income indicator. And we really focused here on the pay gap, the gender pay gap between women and men in Missouri. And it's about 77 cents for every dollar a man earns. And this is an average for the state. So I want to make clear that that average is a key point. And the pay gap is as wide as 51 cents to the dollar that men make. And that's in a more rural part of the state in Carroll County, Missouri. But you can see that it is an average, and just kind of benchmarking that to the national trend, it's about 80 cents to the dollar that a man earns. So Missouri is a little below the national average. A key point to note here too is that women of color, you see the pay gap even wider. So for Black women, it's 68 cents for every dollar a white man earns. And for Hispanic or Latino women, it's 61 cents to the dollar that a white man makes. So we can see that, there are some potentials here if we really want to lean in and close this. So a couple of areas that we have really concentrated on, and you will see in the graph here that there is really a stark difference between, sexes, as you can see with full economic participation of women. And some examples of, again, what's really adds to that pay gap is one is when women drop out of the workforce to start a family and then re-enter, there is when a pay gap starts to widen, as well as when women start their first job. We know that men are much greater at negotiating for pay and benefits than women are. So there starts, a trend for where and why the pay gap persists. So a couple of areas that we have focused on to really close that from a policy perspective and an education perspective is around banning salary history from employment applications. An easy thing an employer can do is just to take that off the table. That not only helps women, but also people of color. The city of Kansas City, Missouri enacted a salary history ban for all employers in the city. And so this is an easy tool that could be replicated in other parts of the state. At the organization, we also invested in the pay equity best practice guidelines, which is accessible on our website as well. And really another easy thing that employers can do is simply just evaluate, do you even have an issue around inequity in pay? And just to do an internal audit analysis of what's really happening within your organization, an easy thing to do as well. Some of the most hard-hit occupations that we highlighted as a result of COVID, but just in general in the equities in pay, is around the healthcare sector, around the education, retail, manufacturing, are sectors that you really see very persistent pay gaps. The next thing that I want to the next indicator that I want to switch to is the education and childcare. And again, we've talked about really what's happened and highlighted as a result of COVID-19, but some key points to mention that really came out loud and clear in the research study is childcare costs are really a kitchen table discussion point, and families are really put in a decision to have to make around maybe one spouse has the earning potential to work, where the other one may need to stay home because the cost of childcare is so great. It doesn't make sense for both spouses to be working. 41% of all counties in Missouri lack an accredited childcare facility, a key point to make here as well. We know in 2019, 7% of the center-based childcare programs were accredited, and only 1% of family childcare homes were accredited. Another key point that came out loud and clear around the childcare and the kitchen table conversation is that infant care is equivalent to the cost of in-state college tuition in Missouri. So an extreme burden that is put on families. And then another key point is 1 in 4 families are led by single mother households. Again, pretty significant for the state of Missouri as well. And then with COVID-19, what we saw really happening is that 48% of our childcare supply decreased as a result of COVID-19, meaning that childcare facilities may have closed, or may, when they reopened, may not have been able to fully bring children back at full capacity. So that means that only 1 spot in a licensed childcare facility is available for every 6 children that need to attend the childcare facility. So again, childcare is a critical issue, and for a workforce development strategy is something that Missouri really needs to pay attention to. The next key indicator that I want to discuss is healthcare. Again, when we focus grouped women, we really heard from low income and mid to upper income women. This is really critical, that preventative health care, regardless of income, oftentimes was put on the back burner. We also know that in the lower income spectrum, that women always forgo taking care of themselves, but made sure their children were a priority. We know that about 9% of Missouri women are without healthcare coverage. Now, we hope that we can see with the recent passing of the Medicaid expansion and what the implementation plans are looking like for Missouri, that we could see this potentially switch. But we really are seeing this as a significant strategy, again, to really elevate our workforce development in Missouri. And secondly, we know that especially during COVID-19, when women weren't taking preventative health care, we know that those who were going through pregnancy may not have been attending or getting those prenatal checkups, and low birth weight in infants is a real priority and something that Missouri is paying attention to as a result of the healthcare strategy. Shifting now to our social and economic issues, I really want to highlight those Missouri women that are 65 and older, and 10% of those women are living in poverty in Missouri. There's a couple of things, key indicators that really are leading us to identifying why that is a challenge. One is we know that women weren't contributing significantly to retirement programs. So women may have dropped out of the workforce, may have been at stay-at-home moms, may not have been contributing to 401ks or retirement funds. But we also know that women outlive men. So women typically are living longer than men and may outlive what they have in their savings. So this is a real significant point for Missourians to pay attention to. When we focus grouped men, believe it or not, this was a priority. Again, a household kitchen table discussion about, does mom need to be moving in the future into our household to be able to provide care for her? And certainly during COVID-19, we were seeing that food banks and senior centers that may have closed, and with this women living in poverty, really put a highlight on a significant issue for Missouri women. Shifting to our final key indicator of the status of women in Missouri research report was around leadership and public engagement. And this really focused on women participating civically, and why this is important to the organization and to the research report. If we have more women around the policymaking decision table, we can have more women talking about the key issues that are impacting women and their families. So another key strategy for United We and for Missouri to really elevate women's participation civically. So we have 51% of the population represented by women, yet only 25.5% of the legislature and executive offices are comprised of women in Missouri. We have really seen an uptick just in the United States in general about the number of women who are running for elected office. But here in Missouri, it's remained relatively constant, so pretty stagnant since we started doing this research report 6 years ago. Several reasons that we have learned through additional qualitative gathering information that we've done here at United We is women want to be asked to serve. So women hold back, whether running for elected office or through an initiative that we've created to really help bring a solution to the table. Women want to be asked to serve. That solution that I want to discuss today is called the Appointments Project. And the Appointments Project works to get women appointed by elected officials at the city, county, and state level. And we see that by having more women sitting around the policymaking table, we see better decision making. And this is true even in a corporate sector, that we see when you have diverse perspectives, experiences, and opinions around the table, you can make the best decisions for everyone. So we created an initiative in 2014 called the Appointments Project, working with elected officials. This project has expanded to include now nearly 150 women appointed at the city, county, and state level since we launched the program. We also are taking it beyond our Midwest borders and have expanded outside Missouri and Kansas, in Texas, Pennsylvania, Oklahoma, and now in California as well. We see this as building the pipeline of our future leaders, and we hope to see more women running for elected office to advocate for those critical issues impacting women and their families. So kind of wrapping this all up together is that this is really the Shecovery, as we stated in the title of the presentation, that the COVID-19 recovery plans must include women. We see that women dropping out of this workforce at such a significant rate, but a significant indicator that, just to highlight in summary again, is childcare is a significant barrier for women. Our research underscores the need for a different future for women and their families to help our communities thrive. The future of work must include paid family leave policies, evaluating, as we've discussed, inequities in pay, reimagine childcare options, flexible work environments, and a new view of work-life balance. Less red tape for women to become entrepreneurs, including access to capital, and having good representation around the public policy, leadership, and decision-making table. These changes can help ease the burden on Missouri women and set the stage for an economically powerful future. And again, we at our organization, United We, are driving to try to get women fully participating so we can see Missouri's economy grow by as much as 15% by year 2025. They're solvable challenges, yet it's critical that we unite now more than ever to advance these policies and strengthen Missouri for women and their families and for the economic development of our state. Imagine, as we discussed, 10% of our economy growing by 2025. It benefits all of us. I would like to report that the full status of women in research is available on our website at united-we.org. It's the status of women-2021. And I also would like to encourage you to take action, to review that, to educate yourself on the critical issues, and visit our website again for additional research studies. We have those 19 studies that I mentioned. And there are opportunities to engage with us, whether it be becoming a United We ambassador or a groundbreaker, which you can find information on our website, or follow us through our social media handles, Facebook, Twitter, and Instagram. So now I'd like to turn it back to Steve. I'm happy to answer any questions that you may have.
That was fantastic. Thank you. Yeah, actually, I was hoping you go a little bit longer, but we do have questions and all. But I gotta apologize, Wendy. I'm not very good at technology. My staff is laughing at me right now. So going back between the Q&A, my phone, laptop, and all this, I'm going to get dizzy here. So I'm trying to make sure I got everybody's questions. But let's start with one that did come across on the Zoom. When you think of the Appointments Project, are there any women civic leaders in history who inspire you?
That's a great question. And I would like to highlight someone that we worked with, former Speaker of the House, Elijah Haar, to get inducted into the Hall of Famous Missourians. And this is Annie White Baxter. And just for everyone, for the viewers, Annie White Baxter was the first county clerk in Jasper County, Missouri, in Carthage, first county clerk in the United States. And this was back in 1876. And Annie was overseeing that job, oversees elections. She was overseeing the elections that she couldn't even vote in. This was pre-suffrage movement. So Annie White Baxter, someone we're extremely proud of as a famous Missourian. She was just inducted in August 2020. So her bronze bust is in the state capitol. I would encourage everyone when they visit the state capitol to take a look and learn more about Annie White Baxter. So she is someone who really was a trailblazer for civic engagement. And I just think about all that she accomplished and cleared the way for what now, with all women, with so many women serving as county clerks, but just for future women elected leaders.
Fantastic. I'm in the Capitol all the time. I will definitely stop by and see that for sure. And this is all kind of a little personal statement on this because our daughter is going to be a senior at Francis Howell High starting this fall. And so we're getting ready for college and her career. And by the way, she is going to Drury. So she'll be a third generation. So if there's any Drury folks listening on here, I think just might be proud of that, but she plans on heading into the STEM field, definitely medical and all that. So we're very proud of her. So we're facing this right now, this career challenge and all that. Women's work. Have you seen any changes in how society or culture thinks of jobs that would be a good fit for women?
That's a great question, and definitely. And you think about women, it hasn't been that long since women really engaged in the working world, in the workforce. And it was about 1950 and more professional, more traditional jobs that women really entered. And so you really seen a shift really in strategies for organizations to recruit and retain and to really have workplace policies that are family friendly. So you've really seen a shift with really more of a culture shift. But as far as industries, we're really seeing, open discussions and, the importance, as I discussed, just to having diverse perspectives, experiences, and points of view around the table. It really improves decision-making, but it improves profitability. And for bottom line, earnings for companies and organizations. The STEM field certainly is definitely trending to really with an intentionality of recruiting women to participate and join and to stick with and really, that engineering, architecture sector really having, strategic career paths outlined for bringing, women entering the workforce, but then following them through middle management and elevating them into key leadership positions. So we're definitely seeing a trend line there. I also would just like to say that the state of California was really obviously extremely progressive in passing a requirement for corporate boards to have representation of women on the corporate boards. And I do think that when you start to have women at the corporate board level, that really starts to infiltrate, to really change the culture throughout the organization. So we see that as a trend line that's really, helpful to clear the path for women to elevate into executive positions. But definitely, there has been lots of movement, I would just say in the last 10 years, significantly.
Fantastic. Well, let me let's concentrate on Missouri. We are definitely, even though we have two major cities, we are not an urban state. We are pretty much a rural state. What difficulties, what trends or things that do rural folks, rural women face in this challenge that's different than possibly urban?
It's a great question. And one of the things that we did with this research study is we really got out to listen and hear from women of all income levels, including those in rural communities. So accessibility to resources is certainly different in rural communities than in metropolitan. I would say a significant, when we did this several years back, was definitely broadband access. So access to the internet was really a significant barrier. Now we know that that has really changed since we did this research study, but there are still parts of rural communities where they don't have access to broadband. So that's a huge gap. I would also say in rural communities, access to healthcare was pretty significant. We heard time and time again, those that may have to travel as much as 50 to 65 miles one way to be able to access healthcare. So healthcare is an extreme barrier. And then I really want to highlight again the childcare piece. In some parts of the state, in rural communities, there aren't accredited childcare facilities, and reliance upon family members to provide that childcare required in order to work, whether it be you're working for an employer or you're running your farm or you have your own business. So significant. And it's really interesting too, Steve, that when we focus grouped women and we were hearing personal stories, so many women really have an interest in becoming an entrepreneur and starting their own business. They have ideas, they have an interest, they have the drive to want to start a business. Access to capital is an extreme barrier for women, especially in rural communities. So those are some of the key highlights that I would say that are differences between urban and rural.
Yeah, key that I definitely got out of this is investment. Somebody's going to ask, okay, how do we do this? You talk about economic development, childcare opportunities and benefits for working women, things of this nature. But there are people going to say, where are we going to get the money? How are we going to pay for this? That's a real question, especially now we're in a virtual world, which is a whole different situation. But I think you really do a great job in showing that if you invest in that, the return is greater than the actual effect or the investment itself, whether it's taxes or things of that nature, or just actually more investment in it. And can you speak to that a little bit?
Exactly. The access to capital is really a significant barrier, and it becomes even more exaggerated for women of color who are interested in starting businesses. So one thing that we've really there are lots of resources out there for women to learn more about how to go about accessing capital. But really, what needs to happen is changing hearts and changing minds, and really educating those that are angel investors, that to really look more closely at those women who are wanting to start businesses. It is often, here in the heartland, that's often overlooked. A majority of the angel investing are invested in businesses that are led by men. So I really do think that, continued education, continuing to spotlight these challenges are critical. And recently we hosted an entrepreneur roundtable of women who are entrepreneurs in Missouri who are interested in starting a business, those who have left the corporate sector that are interested in starting business and left the corporate sector as a result of COVID-19, and really heard loud and clear not only the access to capital, but again, just for those women business owners, childcare access is again an extreme barrier. So childcare, I think, has become, was what we have learned was unstable. But during COVID, it is put even more stress on the childcare system. And it's something that in our COVID recovery, Missouri can be a leader if we take a hard look and come up with some innovative solutions here.
Fantastic. Let's turn away a little bit from STEM and business, that part, maybe go back into my realm, academia, humanities. What's the status of, we know there's a shortage of women going into STEM. What about academia? What about PhDs or scholarship, things of that nature in the social sciences and the humanities?
Yes, we know that the national trend is that women are seeking higher education degrees at a greater rate than men, and that's across the United States. We don't have that statistic broken down specifically for Missouri, but we do know that women seek continuing education even beyond just the bachelor degrees, higher degrees at the master's and PhD level at a greater rate than men do, significantly. So there is we see that again as women are continuing to elevate into their careers, whether it be a career in academia. Childcare, again, I'm just going to highlight, is such a conversation piece that, you know, we need to come up with some significant solutions there. But we do see that women are following in this academia track for sure. I would say, you know, one critical issue across the board, regardless of profession, that I do want to highlight is the inequities in pay. And that includes in academia world, in the education sector. We do see significant gaps. I would also like to highlight that there's been some interesting research done that you know, school superintendents are mostly men, and that if we really wanted to see a culture change, that it could be leaning into recruitment and getting more women into those superintendent roles. And what would that look like, you know, for the future of the education system? So an interesting point that we've taken a look at as well.
Yeah, one of the questions was the pay gap for women at the university scenario and all that. I'm going to get to kind of steer back a little bit about investment economics. And someone has I'll read just what they had sent to me. And it says, access to high quality and affordable childcare is not only good economics, it is critically important for children who live in poverty to start school ready, prepared. Your presentation highlighted both the lack of quality and the loss of seats in Missouri. Child advocates have been sounding the alarm for decades. How can we get the business, civic, and economic sectors champion growth and access, affordability, and quality?
I think it's a fantastic point and a great point. And you know, what I'm pleased and what we have learned is employers are recognizing through COVID-19 just the importance of the childcare, not only, you know, to retain and recruit employees, but for that future generation, and the importance of getting a healthy start on life by having good quality childcare and through accredited childcare facilities. You know, some creativity that's happened, and I'm just going to do a shout out for Cox Health in Springfield, Missouri. And, you know, they pivoted in COVID-19 and really came up with an innovative solution. They had a healthcare, you know, a workout facility on campus they're at their location. And when COVID happened, they took all of the equipment out and they turned that location into an on-site you know, school and a childcare facility so that employees could bring their children there, but opened it up to the community to bring their children there. They turned this around in a couple of weeks and put accredited certified teachers in place to be able to help keep children in summer school and then, you know, move into the fall. But the point that I want to highlight is, you know, innovation is going to be key for Missouri and for our childcare system. So, you know, doing things the way that they've always been done isn't going to get the result that we all desire, and including getting that healthy start on life. So there is that one solution there. I think the other point that I want to highlight that I'm not sure came across loud and clear is the solution of a paid family leave policy. And this is really critical. We are the only industrialized country in the world who doesn't have a federally mandated paid family leave policy. We're seeing that this is, you know, essential for families, you know, in a recruitment and retention strategy. It's a workforce development strategy for Missouri as well. We've really, as an organization, you know, worked with previous administrations, governors here in Missouri. They've implemented for state employees a paid family leave policy. We want to signal that to the corporate sector and to other organizations as well, that you can do it too. It's important not only for the birth or adoption of a child, but again, that healthy start on life for mothers and fathers to be able to take time off from work, not have to choose between work and family, to make sure that that child gets a healthy start on life. So I think there's some strategies that we can put in place, Steve. It's not a, one size fits all and easy solution, but innovation is going to be critical to our workforce development strategy for Missouri economy.
Innovation is a very crucial word in every sector. There's no doubt about that. Innovation is important. Can you talk more about work-life balance? How is that idea evolving and changing?
Yes. Well, certainly what we're seeing here, with COVID-19, what we like about, a positive is that flexibility is the name of the game. And we have seen, organizations, companies really pivot to a flexible work environment. And we hope that that trend line is going to continue post-COVID, that that's really going to provide that support for that work-life balance. So maybe, work life looks like, a couple of days working from home remotely and maybe a few days in the office. It could be a full-time working remotely, but that really is important and brings fresh perspectives, good critical thinking, takes the pressure off employees, brings good frame of mind, drives innovation and creativity to the bottom line and to the organization, helps build a positive workplace culture. So we see flexibility as really a critical issue to that work-life balance for the future.
What about job training? Is there any secrets here or something? How can that become a crucial advancement for women in the workforce?
Yeah, you know what, Steve, COVID-19, I'm really concerned about this because with so many women fleeing the workforce, we've lost that institutional knowledge, that intellectual property just walked out the door. Employers are really scrambling now to look at, building the future bench for what just walked out of the door. And really, again, just to highlight, that was a result of childcare. So, workforce development, work on the job training is going to be critical to further build the bench, build those who've left the workforce, really critical as far as a recruitment and retention strategy. We see that, that employers are really concerned that so many of the middle managers of women who were on the track to, accelerate and on the path to potentially into the C-suite, to the executive suite of the organization, just left the workforce as a result of COVID-19 and their children being home from school. We're not sure. It's really early in the recovery and what this really means. There will be lots of research studies done, but this is something that we all need to pay attention to, for sure.
One of the we're Missouri Indian Humanities Council, probably our number one partnerships tend to be institutions of higher education. National Endowment of Humanities likes to see that and everything. We also feel that community colleges and technical colleges are equally important, if not more important. And can you explain the role of that? Because sometimes community colleges are so crucial to Missouri's economy. Talk about community colleges, technical college, and their integral role, their crucial role in helping women.
Absolutely. And you know what, we've also seen those industries that are less traditional for women to enter, such as the construction industry, that really are having a very condensed curriculum that's been developed through a community college or a technical college to really get the skill set needed to accelerate the learning and then get the student out into the workforce, starting to work. There is a significant demand across several sectors, but we really have, enjoyed seeing the construction industry really welcome women to the table and welcome women into that industry, and really seeing, flexibility and creativity and innovation with these accelerated curriculum development programs to get students out and working. So really real innovation and creativity across the board. I highlighted the construction industry, but there are several sectors. that have been welcoming to women. And it's really important. You know, a four-year university is not a one-size-fits-all. You know, internships programs are really critical for women, but men as well, to really, you know, test waters on what may be a future career path for them as well.
And a footnote on that is many of our fantastic community colleges and technical colleges in Missouri are in rural areas. So there is an answer to you know, that rural aspect of it, which tends to be tougher than the urban areas. So I hope the population needs to understand that there are some opportunities for that. Quick, all right, let me, because we're going to have to close up here. I did want to ask about the military spouses quickly.
Yes.
That is crucial. You know, someone's overseas serving our country. Speak to that just quickly if you can.
Yes, the military and veterans has a soft place in United We's heart, and a couple of
Good.
things we've done. We were instrumental in the Missouri, the Veteran Survivor Grant Program for Missouri, which means, and Steve, you'll love this being in the education sector, that means that anyone who lost their life, their spouse or their children, or if they were injured in the line of duty, they are eligible for in-state college tuition reimbursement. So there's state scholarship funds available if they apply. We just really want to get the word out and let people know that this is an option that is available. It's a piece of legislation that United We worked on, and then we came back and we released the sunset. So it means it goes on in perpetuity as long as it's kept into the annual budget in Missouri. So something that we feel very passionate about. Another key piece that we have worked on for Missouri is reciprocity, meaning around the professional licensing space, something that's been really critical for us. That we see this as a path for entrepreneurship, but just we know that women hold a professional license at a higher rate than men do. So a license to be an attorney, a physician. And we want military spouses and veterans to be able to come to Missouri and practice their profession immediately without having to go through certification requirements. So we worked last year to push some legislation through. Governor Parsons signed with us HB 2046, which really released that military and implemented a military reciprocity immediately in the state. So something that we're very passionate about.
That's fantastic. We got a very nationally recognized veterans program that we are expanding. And I did not know any of that, what you just said. So I know much of my staff is listening, so they're going to write this down for me, and we're going to spread that word everywhere we go with that. That's fantastic news. I hope the audience spreads that as well. Our veterans and their spouses and their families have earned that. One last question. So pretend like you're talking to my soon-to-be 17-year-old daughter. Is there a secret route that I don't know about, and maybe mom doesn't know about? Is there something you would say, hey, here's a little hint that you might want to keep under your cap?
I think that is such a great question, Steve. And I always think about what I know now and what would I have told my 17-year-old self. I would say that you've got a voice, you've got opinion and perspective, and to use it. And oftentimes we see that women hold back. We talked about women holding back in the capacity to serve, that they want to be asked to step up, to use your voice, to tell your daughter to use your voice, that she has an opinion perspective. She will be gaining experiences that will make her unique. And that is going to be valuable to the decision-making table, and that to feel empowered and to not hold back. And I would say, if I could go back in time to my 17-year-old self, I would say, speak up. Speak up. You've got a voice, and when you think you're using it, you can use it a little louder.
That's fantastic advice, and I'm feeling good because she fits that for sure. He heads off to girl state here sometime soon, so she's raring to go and everything. I'm going to try to answer. There's tons of questions here. We got to wrap up here in just 1 minute, but I do want to get one in. What are problems with cultural constraints? How do you overcome that?
Yes, some cultural constraints that we've really worked on as an organization. It's not, a most positive topic, but definitely, in the workplace, to really create that positive, family-friendly workplace culture. So really, we've talked about so many things: flexibility, the childcare, really having some empathy toward those that are, working moms and fathers that have young children. but also, sexual harassment in the workplace is really been elevated, highlighted, spotlighted. Lots of people are under stress as a result of COVID-19. We have seen domestic and sexual, abuse on the rise as a result of COVID-19. And so this is something that, we're focused on more of the workplace culture, and would just really like to say that, some strategies there is to create an open environment for reporting. So when something isn't working well, that to be able to have the mechanism in place to share that information. And again, as we, are sharing advice to your 17-year-old daughter to use your voice and to speak up, and to create that workplace culture that provides that opportunity when something isn't going quite right, to feel comfortable in sharing that there will not be retribution as a result of it. So that's, we could go on and talk about that, but if there was, waving a magic wand, if we could create, a positive workplace culture, again, drives that bottom line, that's what we would like to see.
Well, I could talk on and on and on. I'm sure people in the audience would want to do the same thing with all the questions, but we do have to wrap up. We do have an 11 o'clock session and an all day. Wendy, thank you for a wonderful presentation, and I look forward to that our organizations will be working together. For anybody in the audience, if you have questions, concerns, issues, you want to help, contact Wendy, reach out. That's united we. And so take some action. And I know we will be working with you in the future, but thank you so much again for a wonderful presentation, and we'll look forward to working with you in the future.
Great. Thank you, Stephen, for your great work as well. It's been my pleasure.
Great. Thank you again, everybody. We have an 11 o'clock session coming up, 11 Central Time. So we'll see you all then. Take a little break.